Morning, everyone. Dr. Eric, the fitness physician. Happy Sunday. Happy Easter Sunday, actually. Yesterday, I did a short video on symptoms of low testosterone. Kind of continue on today, then we'll mix it up a little bit tomorrow and get back to this down the road. But today, I just wanted to mention a little bit more about testosterone. I've done this before in some PowerPoint presentation, but wanted to go over the medical importance of testosterone. Of course, a lot of people will, especially men, will want it because they want to look better, right? They want to build up some muscle, burn off some fat, which it can definitely do in appropriate dosages. But there's a lot of medical things behind it too, just similar to estrogen, progesterone for men and women. There's medical importance. It's not about the outside, it's the inside. We want to live our prime life, live healthy, strong, inside and outside. So medically, very important as well. Of course, we talked about muscle and sarcopenia. Sarcopenia is that loss of muscle as we age. Some of it's due to anabolic resistance, poor diet, lifestyle, etc. But hormonal dysregulation can affect this as well. And sarcopenia is massively important. It's not just about looks and having those guns, right? It's about ability to just walk as we get older. That's why there's so many falls. People are just weak and they can't hold themselves up. They can't right themselves from a position. Their balance is off. They're more prone to injury. They get thin and frail. So sarcopenia is massively important from a health perspective, as well as in terms of overall health. People's well-being, mortality. People fall and in the hospital. They get pneumonia. Millions of dollars spent on this, and then this can all be prevented. So preventing this is massively important. I've talked in other videos about the importance of muscle and all the myokines it produces, that it's an important endocrine organ. It's the biggest endocrine organ in the body. So a whole nother topic I'll get into later. But bones, and again, similar content, bones and osteoporosis, osteopenia, preventing that, helping maintain strong bones so we don't injure ourselves, fall, get weak and frail, and have an injury and a debilitating fracture. Fat, obviously can help us burn off that dangerous visceral adipose fat, subcutaneous fat, but also the fat underneath, which is the dangerous kind, which is inflammatory, and therefore it can help with decreased inflammation, prevention of metabolic syndrome, diabetes, coronary artery disease, atherosclerosis, and more. So it's a metabolic factor at play here by decreasing the bad inflammatory white visceral fat. That can have massive benefits on cardiovascular functions. And speaking of that, again, improved cholesterol profiles, coronary disease, and carotid intermediate thickness. Basically, the carotid artery inside there has tissue, and that tissue can get thickened. The intima, the inner layer of that vascular tissue, can get thickened and inflamed, which of course can predispose to strokes and other neurologic or vascular disease. So again, estrogen, testosterone has shown to reduce this. Massively important. Cholesterol, everybody says, oh my gosh, you can jack up your cholesterol with testosterone. Yeah, if you're using massive doses, which you should not be doing. If you're working with a qualified age management physician like myself, I will do it appropriately. Your HDL will get better, your LDL will get better, everything will improve. And again, it's not just about the cholesterol, it's the inflammation behind, but these are important things to track. Especially for my women, my female patients, skin and collagen helps, similar to estrogen, massively important for maintaining proper skin and collagen, which is not only important for just the looks of the skin, but the tensile strength and collagen, of course, in the joints, with preventing joint dysfunction or pain. Another area, of course, is cognitive, brain, mood. It's antidepressant effects, improved mood. And of course, the brain, improved cognitive function, memory, recall, prevention, and helping against developing disease such as Alzheimer's disease and other cognitive impairments. So again, obviously, we want to keep our cognitive faculties as we get older, so this is huge. We talked a little bit about anti-inflammatory effects, reducing such inflammatory mediators as TNF alpha, tumor necrosis factor alpha, IL-6, CRP, etc. So this is, again, hugely important in terms of reducing inflammation in our bodies. We know inflammation is the major cause of dysfunction and problems in causing illness and morbidity as we get older. Improvement of immune system function in general, especially now we're dealing with immune threats everywhere, so maintaining our optimal immune function is important. Overall, decreased mortality, and again, this is just something that's always a good thing. Study after study has shown that it does not cause prostate cancer, it does not cause men to die or get thick blood and all these things we can talk about in future episodes, but it actually, again, when dosed appropriately, reduces all these. Study after study has shown this. The older studies that were flawed have shown some contradictory, but there's been hundreds of good quality studies since then have proven this again and again. So, again, like I said yesterday, contact me or another qualified age management, health optimization physician or clinician. We can work with you. Don't buy stuff online. Don't try to screw around with it yourself. Or listen to any of these internet gurus who have no medical background whatsoever. You've got to take care of your health properly. And I work with these people all the time, and it's a team sport. I'm happy to help, and there's a lot of people putting out great information. I don't want to disparage that, but when it comes to the body, there's nothing behind that clinical experience working with patients one-on-one, sitting down with them, having been there, done that, seeing all the complications that can come from medications and side effects and other many things I can't even get into right now. So yeah, I'm happy to help. Again, I'm offering some free initial telemedicine consultations. We can get on board, talk about hormone optimization, peptides, talk about many other things. We've got a lot of nutritional and fitness programs coming out. Created my own Meta 3 supplements for an AM and a PM version for fat burning and optimal adrenal function, sleep, and mitochondrial function as well. So check that out as well. Hope everyone has a great Easter Sunday. Remember the importance of Easter, and everyone live great. Have a great day. We'll talk to you soon. Bye.